a person is infected with COVID. There are also a lot of questions in our minds on the after COVID care. To clear the doubts and questions that is lingering in the minds of many of us, PMIPCC is pleased to bring on a session with Dr. Ravi Shankar. And before we start into the session, I request President Venkat Reddy to please give welcome remarks on this session. Over to you, Venkat.
Thank you, Gokul. Can you hear me loud and clear?
Yes, Venkat.
Thank you. Very good morning, all of you. First thing, I hope all of your family and friends are safe and doing well in this pandemic situation. I think most of us know how devastating COVID is, especially the second wave. It's really overwhelming physically and mentally for all of us at the board and also for chapter members and families as well. So, there are in multiple ways it hit us. Some of us have lost friends, family members. So there is bad news floating around each and every day, with some notable personalities lost to the COVID. So impacting livelihoods and economies also in a significant scale. The overall health and administrative infrastructure in the country is also challenged. Okay, so we are really wondering what really happened, especially in the second wave from last 3 to 3.5 months. With I think all of you who read through the metrics, so the peak cases went up till more than 4 lakhs, 14.14 lakhs is what I read last time when the peak happened a couple of days back. And though it is plateaued a bit, we are talking about 2.4 lakhs now, but the deaths are still, the rolling waves, the deaths are still at a higher number. So I don't want to intimidate all of you with these facts, but these are some things that we need to know. And overall cases, confirmed cases itself crossed more than 26.5 million, and also the deaths itself at 2.2 lakh 95,000 plus. So I think there is still a significant concern in terms of while the number of cases impact the daily number of cases and recoveries are going good and daily number of cases coming down, there is still the impact of the second wave is very high, and we are talking about third wave. Okay, so we are also hearing about significant concern about new variants, third wave, black fungus, white fungus, which is really making the environment further bad. Okay, so that's where we thought this session will definitely help us. So basically, if you look at the current environment, so we are facing three kinds of viruses to me. It's not just the COVID itself. So that's the core virus. We are also dealing with mental and physical stress. So there are many of us going through this bad news every day and stressed in multiple fronts while balancing our day-to-day activities. That is the second part of it, where how we balance our mental wellness and physical wellness as well. And there is third kind of virus, I call it as, because there is a lot of fake news floating around. Social media is people are using to their advantage, and there are social media treatments floating around. There is misguided media. So this is all come under the third virus I talk about. So these are the three kinds of viruses we are dealing with in the current environment. So from the chapter side, we would like to educate our members by bringing in experts like Dr. Ravi Shankar to answer all our queries in terms of, we have a lot of questions like Gokul mentioned, how we deal with the virus, how we recover from the virus, so how we safeguard from the virus. What if I have some other problems like health problems, blood sugar, and so on and so forth? How would this virus may impact? Okay, how I can safeguard my family? So there are various questions we are getting day in and day out. So it's not always the WhatsApp messages are the only answers, right? So we can directly talk to interactively the experts. That's the best mode where we can try to find answers directly in the interactive mode. So that's where we are going to, we are actually organizing this session to answer all these questions for us. So before getting into the actual session, so I would like to give a few hints about how PMIPCC intervention in this moment of crisis. So we are trying our best to organize various sessions. This is the first session to start with, in fact. So we're planning to organize a session on wellness as well. So the second virus I talked about in terms of how you can deal with your mental and physical stress. And also we are working with organizations like TIMS, Telangana Institute of Medical Sciences, how we can support their day-to-day requirements for the patient support. We are also working with organizations like Robin Hood Army. We still need to provide the required support. We are discussing with them in terms of how we can, the basic need of food can be provided. So there are various options we are looking at from the chapter, how we can intervene at this moment of crisis. So that's a bit in a nutshell. So more in the coming weeks, we can explain what exactly the set of activities finalized from the chapter. So with that, I'll request Dr. Ravi Shankar to explain about some of the challenges currently they are facing. I think, and first and foremost, I salute all the doctor community from the chapter side. I think they're doing a phenomenal work in terms of facing from the front this kind of a pandemic situation. So salute to all the doctors community from our side, sir. Over to you, Gokul.
Thank you, Venkat Reddy. Thank you. Without further ado, I would like to introduce Dr. Ravi Shankar. He is a senior interventional cardiologist and head of department cardiology in Continental Hospital. He has 18 years of experience in the field of cardiology. He got a fellowship in American College of Cardiology and European Society of Cardiology, expert in complex angioplasty, emergency cardiac cases, hypertension, and heart failure. Awarded with the best cardiologist in Telangana, and he is also awardee of Vidyaratna on a Doctor's Day. And today, Dr. Ravi Shankar will be discussing with COVID care and how to prevent COVID infection, what to do with when you are COVID positive, and what the precautions that you will take after post-COVID. Thank you, doctor. Thank you for joining today. And now I will stop presenting and I will give a presentation to doctor.
Thanks, Gokul, for your kind words. Thank you, Venkat Reddy Garu, for giving this opportunity. I am Dr. Ravi Shankar. Gokul, can you, if you switch off, yeah, I think I will share my content. Yeah, now I can share, right. Yes. This pandemic has taught us many lessons. And I think my first slide is very clear. It's empty. And up to almost more than 1.5 years, we have not learned anything about COVID. That's what this slide shows. So every day, every hour, we are learning lots of things about COVID. First, we have learned something we want to learn, and we have learned in COVID-1, SARS-1 virus, and somehow we have able to manage the first wave, and then becomes the second wave, and it's really challenging because the virus is vigorously mutating and changing its shape and color, and that's the reason new variants are coming. That's giving the challenge to the whole medical fraternity. Now, the first wave, we thought so many drugs. Now it has been outdated, like HCQ outdated, Remdesivir now outdated, Fabiflu outdated. So many like plasma therapy is recently also outdated. It's of no value. What we do is evidence-based medicine. So this allopathic, what we are treating to the public is a purely evidence-based medicine. And any drug we are trying to the patient definitely must have some scientific evidence. And of late, because of all this crisis, you must be aware that so many patients are restless, and they are going to this because they are restless because the situation surrounding them. They are restless because of these news agencies, half truth, maybe not half truth, maybe 25% truth and 75% they are concocting the stories because to increase the TRPs, maybe WhatsApp factory, which is really causing all this nonsense fake news. Of course, the public is restless. Anywhere if they are getting or even anything news, they are going. Recently, also we saw that so many in Andhra Pradesh, there are drops are they are incollating in the ice. But to my surprise, so many patients collapsed. Even after that, they came to hospital. I have a video in this. Uh, we will discuss what are the things scientifically proved and how to prevent this at this juncture. What we have evidence. To that, the information of the COVID is rapidly changing, sometimes daily, and international agency like CDC or NIOSH or Indian agency like ICMR, MOH, and state health department, they are changing the guidelines every day. I am Dr. Sai Ravi Shankar. I am right now working at HOD of SLG Hospital, which is at Bachpalli. We have patients almost loaded with 300 patients as of now, and ICU are full, and of course ventilators are full. Mid of first week of May, it was a very situation is very grim, and now situation little bit better because of maybe because of this lockdown, and still the I can tell that the all the responsibility goes to the public. And once we know COVID behavior, then only we can control, otherwise no. Briefly, I will talk about only 10-15 minutes. I will skip up few of the slides, and I love to interact if you have any queries because of unnecessary this theoretical. I don't want. So coming to this, any IT employees and worker responsibility. So I have focused on this. Actually, this is regarding your IT guys who are working with us. If you have any concern, please speak up. Don't hesitate to speak up. In the first wave, we have seen that every employee or every citizen is scared to disclose their symptoms, to disclose it is a positive. But now, please speak up to your HR, to your medical professional, or to your employee, or to your colleagues, so that immediately you can take precautions and treatment. Only treatment for the COVID is early testing, early treatment. So three T's, which is a golden: testing, tracking, and treatment. Tracking is not possible because it's already community transmitted. So worldwide, it's a pandemic, and already Dr. Venkat Garu has told it has crossed more than 26 lakhs positive cases. And previously, US was now India is the leader of all the COVID. Be informed and prepared. Always, that is the only thing is wear a mask, maintain social distancing, wash your hand frequently, use alcohol based hand sanitizer, or better is soap water. Avoid touching your eyes, nose, and mouth. That's what if you are wearing a mask, you cannot touch immediately. Stay home when you are sick, even though the RT-PCR will come 2 days. The report will come now 2 days because of it's a the centers are overloaded. So within these 2 days they are the very important spreaders. So stay home when you are sick. cough, sneeze, tissue paper or elbow, or just like this, which I have done. Disinfect the frequently touched object and surface, or most important is your cell phone. So how to do the hand wash? You must be doing that. So basics, what is the basic I will tell about? The SARS virus is a SARS-2 virus. There are 5 types of SARS virus. Now what COVID-19 is a SARS-CoV-2 virus. Now in phase wave 2, we got so many like virus of new viruses, new mutants, and they have coined Indian variant also. So Indian variant now, which is rapidly spreading in India, like in Punjab, West Bengal, is a, they have coined, the WHO has coined virus of concern, VOC. So it's not to call that Indian virus, they have the name labeled as virus of concern. So transmission, mostly it's a droplet aerosol and through the air also. Incubation period somewhere around 2 to 14 days. So if you are infected with a virus, the symptoms will come maybe after 5 to 6 days, maybe up to 10 to 14 days also. So please wait up to that if you are symptomatic, like the classical symptoms like fever, cough, shortness of breath, sore throat, body pain, headache. Now in COVID-2, the second wave, we are seeing atypical symptoms like body pain, loose motions. These are the very important. If the patient does not have even a fever, also we are getting COVID positive, RT-PCR positive. And if you are warning signs is very important. Every person should watch for their saturation level and the temperature level and the heart rate level. If the saturation coming down less than 94, immediately consider to go to any of the medical profession. If you are a suspect case, a potential exposure within 14 days before onset of symptoms, any of the symptom, don't hesitate. Please speak up and inform to your colleagues or any of the nearest medical profession. If you are confirmed, definitely gold line is RT-PCR. Second is antigen test. Now ICMR has approved home test also. So outside body, how long? That is again a controversy that depend upon the surfaces to surfaces. That is still it is so many school of thought is different. So what are the risks? Severe illness for people underlying health condition. These are the patients. They should be very careful. Those are having heart disease, those are having asthma and lung disease, those are diabetes, and they are those having immune system suppressed. These people should take care 10 times more than the others. So seasonal flu, you must be knowing, and a pandemic. So we don't know. We are expecting any, as per the seasonal flu or pandemic and the past history of any of the pandemic, all pandemic will have a 3 waves, first, second, and third, and slowly the immunity level of the whole the citizens will increase, and of course by the inoculation of the vaccines, the immunity level will increase, and slowly it will flatten. So key exposure factor in the workplace: does the work setting require close contact with people potentially infected with COVID? This is what the HR has to see that. Specific job duties require close, repeated, and extended contact with people known or suspected COVID. Has the community spread of the virus include case in the workplace also? So what are the high potential exposure? Of course, high potential is the healthcare workers or those who are dealing with the medical profession. They are medium professional exposure like retail store, public transporting, home visiting occupants, postal and warehouse, and any of the public services. And these better to avoid this. So better as much as possible, don't go to any of the public places where too much of gathering are there. Low potential exposure, those do not require contact with people known to be infected or frequent contact with the public. So what are the things you have to do in a workplace connection? For exposure, like works like schools, sports and events, social service, high density co-workers, and high contact with the general public, including all these things, as much as possible, better to avoid it. Um, Government is doing, IT sectors are doing, which I have told it's the individual responsibility of the all the citizens. Then only we can control this or we can break this chain. Public health officials, they will give us the guidelines only based on some scientific evidence like ICMR, which they are giving, and then we have to follow some of the guidelines, and it's the government of respective state, as per the condition, they will implement what are the things to be done, and how to manage the COVID to the hospital and to the public. They will give every day or every weekly, they will give some guidelines like lockdown. So basic hygiene and social distancing is stay home when you are sick, wear a mask inside your house also if you are having some of the symptoms also. So most of the time now in COVID-2, we have seen that one person is infected, whole family member in that house is infected. It was not there in COVID-1 and COVID the first wave, and COVID second wave we have seen that it is. That shows I am not 100% confident. That shows that it is aerosol and infected through the air. So government of India and the ICMR even told that wear a mask inside your house if you are asymptomatic. Wash your hand as much as possible whenever you are touching anything after coughing or after sneezing, and cover cough and sneeze with tissue and sleep, which we have told. Almost everybody knows. Still there are few people even shaking hands in a religious function or in any of the gathering. Better to avoid all these things. So the hierarchy of control is first elimination, physical removal of the hazards, replace the hazard by substitution. There is engineering control, isolate people from the hazard, change the workplace and protect the worker and personnel if at all they are high risk. Then I will few minutes I will talk about the mental health. This COVID a great loss to the human life, and those who has lost their life, really we are very sorry for that. But those who are surviving right now, those post-COVID infected persons, they are literally mentally health and stress are, levels are very high. We have done two studies. One is those who are affected with COVID and they have recovered. For them, what is the mental status and strain? Number two studies we have done that those family members and relatives or their family and friends, what are the mental health status and the stress? It's a really it will take minimum couple of years to really relieve that. They are in a financial crisis, they are in a severe mental stress, and day in and day out these TV channels and the WhatsApp factory and social media is bombarded with a news. So because of that, even 85-year mentally stressed, 15-year adolescents are very much severely stressed, maybe because of so many reasons. And it is a high time that we have to focus about the mental health of the all the citizens and working with the IT companies, and because work from home is a mental stress, which we have found that. The children's which the schools are closed and colleges are closed, they are literally having a mental stress. And those are having even the wife and husband, they are in a lockdown, they are staying in a house and work from home. Of course, the data shows that divorce rate has almost increased by more than 60%. So mental stress, definitely we have to take a session, as Mr. Venkat Reddy Garu has told. We have to take a session for this. Role of vaccine, only a ray of light we can see is the role of vaccine. It's 100% we have to take, whether it's effective or not. But I can tell you, as my experience in last 1.5 years, really I am dealing with all the COVID patients day in and day out. It is working. So if it is 80% are working, then maybe even the vaccine companies also told that 97% are effective. The death rate is absolutely coming down if they are inoculating. I am not telling that it is 100% working, but as per the data, which very clearly tells that now the deaths are more less than 45. So 18 to 45 deaths are more. The data itself very clearly says that 18 to 45 they are not vaccinated, maybe because of that. So the vaccine will work definitely from 80 to 90%. It does not give you the guarantee that the COVID, you are not immune to COVID infection. Any person vaccinated, even 2 doses also, not only one, 2 doses also, they can be infected with COVID. Only the difference is they are, the COVID is not that much of seriousness. So they might be a asymptomatic carrier or mild symptoms, or at best moderate symptoms that depend upon the immunity status of the patient. So vaccine you have to take at any cost. So that is and the treatment part, don't go through the Google chart and Google don't, because so many times we have seen that patients themselves taking remdesivir, taking from the black market, because remdesivir, as per the government, it is banned individual retail counter. They are taking. Most of my patients, they are asking, they are demanding why you are not giving remdesivir. So steroids, don't take any chance. Better to consult a doctor, because the role of steroid is very clear. If your saturation is less than 90, then only the role of steroid will come. Otherwise, the role of steroid is not at all required. So I request all this, whatever the treatment part, it is better that you should consult a doctor first. Then even for the steroid or a remdesivir, in general, the best thing you have to do is, if you are having any symptoms, please tell to any of your relatives, or better to, as early as possible, do the testing and consult the doctor. I have seen for last 1.5 years, those patients, they early testing and early treatment, definitely it will be helpful for them. Most of the patients, they are coming in the late hour, maybe after 2-3 days. We have seen all the patients, they are coming with saturation 60 to 70, because they are asymptomatic. That is what the irony in COVID. That is, we have coined them happy hypoxia. Means your saturation level is 70, still you will not feel breathlessness. That is happy hypoxia. So better to take immediately testing, and some of the viral markers like D dimer, ferritin, and CRP level. Depending upon that, we can see that what is the viral load. Then followed by CT scan of the chest. If it is required, definitely we will ask them to CT scan of the chest. And depending upon that, we will decide what is the course of action. If it is a mild, moderate, and severe, we have a clear-cut guidelines. We will we will treat as per the patient's condition. As much as possible, those who are eligible for vaccine, 100% you have to take vaccine. Some protection it will give. Seriousness of the disease definitely will decrease because vaccine will increase the immunity status and antibody status, and the seriousness definitely it will decrease. I think by this I will take few of the questions and queries. Over to you, Gokul.
Thank you, Doctor. Thank you very much. It's a very entertaining session, and we would now request all the participants to ask the questions. So, Komal, can you please make everyone unmute?
Great, thank you so much. Gokul, I'm sorry. Dr. Ravi Shankar, very good morning. I'm 38 years old. I was tested positive 3 days ago. My mother is 60, my father is 71. They both also tested positive. So my father finished azithrol 500, a course of 5 tablets, and Cifran 500, 6 tablets. So he's had this temperature since last Sunday, doctor. And now for the last 2 days, he has no temperature. His, what do we call this? D-dimer report says that the score is 563. Slightly elevated is what the D-dimer report says. Does he have to take any blood thinners, doctor?
He is a diabetic?
No, he's not a diabetic, doctor.
But age is 65, you told?
He's 71.
Yeah. I think the role of anticoagulant is definitely it is true. If any high risk patient, age is a factor and male sex is one of the factors. So first part, the fever, it will take minimum 7 to 10 days. Off and on, it will come. Sometimes few of the patient off and on it will come.
Right.
So just ignore the fever part because it can be controlled with the paracetamol tablet.
Right.
You have to concern about the saturation. If the saturation is more than 94, nothing to be done.
Okay.
And 3 important blood parameter like D-dimer, CRP, and ferritin.
Yeah.
If these level are normal or just above normal, you have to be in close watch to the patient. And
Okay.
about the blood thinner, we recommend even to blood thinner for this type of high risk patient. I consider it's 65 is a little bit high risk patient. For
Right.
15 days, you can take even ecosprin and clopidogrel or ticagrelol. You can take.
Okay.
I don't advise any rivaroxaban, but antiplatelet agent definitely will helpful. Moreover, these antiplatelet agents hardly have even 0.1% side effect.
Okay. Okay,
So
doctor.
as per that, I have to manage the risk versus benefit ratio. I can see the benefit is more than 90% and risk is hardly 1%.
Okay. Okay, doctor. And one other thing, the CRP is 6.8, doctor, for him, for my father.
No problem.
Yeah.
CRP is 6.8, so D-dimer 500 plus. It's a borderline. Your father is looks like very safe, nothing to worry. But the second wave, which we have seen that after 14 days also patient becomes symptomatic. So I request at least for 14 days you keep a watch on your father, only saturation level. If any symptoms, please consult a doctor as of now.
Okay, doctor. And doctor, about my case, last 2 3 days on day one. This is my 4th day, doctor. Day one, I had a severe headache, skull crushing headache. Today I feel a little better, but then there's a lot of weakness, and I started developing this phlegm in my throat. So this is day 4. Do I have to be worried, doctor? I'm taking ivermectin, Dolo 650, and doxycycline, all these tablets. So
How many
anything.
days you have taken Doxy?
Doxy I started yesterday, doctor. I've taken 2 yesterday. I've taken 1 today. So I started with azithrol 500. Since I had diarrhea, the doctor moved me to doxycycline.
Right. Diarrhea is a part and parcel of the COVID. So if you are having a diarrhea, better to take sporolac sachet, which is a very common.
Okay.
So we don't, and as much as possible, you take ORS and more water, and the cough will be there, fever will be there. Already you have started some antibiotic. Wait for some time. Take some cough syrup also. The bronchodilator is definitely helpful for this type of patient. So
Okay.
some cough syrup, Grillintus VM, and antibiotic will sufficient for you.
Okay. Okay, doctor. Thank you so much. Thank you.
Thank you.
Hello, doctor.
Yeah, some disturbance is coming, Gokul. Are you getting there or I am getting?
I will request all others who is not talking, please go on mute. And anybody talking, please unmute themselves and speak up. Thank you
Yes.
all.
Hi. Hello, doctor.
Yeah, please.
Good afternoon. So, my husband is diabetic and he is 42 years. So, last month he got COVID positive, exactly on today's date. And so, immediately we have consulted online. And next day, on the second day, we have done his HRCT. So, his COVID test was 16.5. Okay, but HRCT was very normal. So the online doctor has given only two medicine, Dolo and Doxy. Okay, these two and the multivitamin tablets. So within his symptoms were very much mild, only like 99 fever and cold and cough, nothing else. So within 10 days he recovered, but a little weakness is still there. So what I wanted to know, since he was diabetic, even after recovery, do I need to do any kind of test which others are doing like D-dimer and all, or I can just relax like he is recovered?
He has recovered almost, he has infected 1 month back and recovered almost 20 days back.
It's
So,
15 days he has recovered, yeah.
okay, anyway, he is a mild symptoms and he has recovered. The doctor has given Doxy and the Dolo. He is perfectly correct.
Yeah,
And
he did, yeah.
as of now, you have to see that his blood sugar is under control. You have to take whatever the medication, and with that medication, if the blood sugar is normal, nothing to worry.
Yeah, I checked fasting weekly once and fasting is coming around 130. So is that okay?
120 is okay, but let him do some diet restriction like sugar, all the, if at all, even tea, coffee he is taking, better too. 130 is the borderline. Okay, I don't think it's a big deal.
Okay. Okay. Thank you so
Thank
much.
you. Thank you.
Good morning, doctor. This is Vani here. I think you very nicely explained about various symptoms and how to take care. Thank you so much. In my house, everybody's got COVID, and then I am the last person to get. I have been vaccinated also all the 2 doses, so I have got very mild symptoms. I just had a nose blockage, and then I lost smell and taste, and then within 3-4 days, I got my smell and taste back. So after 10 days, I got myself tested, and then I'm still COVID positive. So what do I do? Should I take after? I mean, when should I
It's a
take my
basic thing. I just want to tell to. I think there is. I'm clear, Gokul?
Yeah. A little echo is coming. Can you all please mute yourself, everyone in the.
Yeah. No, it is fine. Right. The basic thing is ICMR and Government of India or MOH, we don't want to repeat the RT-PCR. If you are infected and recovered, what is the definition of recovery? If you are asymptomatic for 10 days, you are recovered. I am very clear. If you are asymptomatic means no fever, no cough for 10 days, that means you are recovered. No need to do RT-PCR. Why? ICMR also given 3 times guidelines, no need to do RT-PCR, because if you do RT-PCR, even a recovered patient, you will get positive. Why? RT-PCR is just a PCR test. Even if in the dead virus also, If your body is having a dead virus, RT-PCR will be positive. Just ignore the RT-PCR report. Now, few of the central government and all this they are asking, but it is not at all mandatory to do the RT-PCR, not required at all. So if you got a RT-PCR positive after 14 days of your recovery, just ignore it. Nothing to be done. I request all these volunteers and all the employees not to do the RT-PCR after recovery. After, if you are 10 days asymptomatic, no need to do RT-PCR.
Thank you, doctor.
Good afternoon, doctor. This is Kashyap.
Please.
Hello. Yeah. So I'm a construction professional by nature. So we usually require traveling to sites on a daily basis, but that has stopped since 20th of April. And from 20th to 27th of April, I didn't visit any site. And on 27th, I had to do a site visit. So by the end of the day, I returned home. I was not feeling so comfortable. So I thought there was a little weakness. Then when I checked my temperature, it was ranging between 98.6 and 99.2. So the next day morning, the temperature was normal, and for 3 days, by the time it is evening, my temperature used to raise to 99.5. So on 30th of April, I went for an RT-PCR. Okay, from 27 to 30th, I isolated myself. On 30th, I went for an RT-PCR. So on 1st of May, the result showed negative. In fact, it didn't show any CT reading, and it showed negative. So I completed my home isolation after that for another week, and on 7th again I had to go to site. So when I went to site and when I returned again, the temperature was showing. Like morning it was normal, and by the time it was evening, again the temperature is ranging between 98.6 and 99.2. So again I isolated myself for 10 days. So should I be concerned, or it is the nature of the body that the temperature sometimes will shoot above 99? Because I have no other symptom. It is only the fever, no other traditional COVID related symptoms, nor loss of appetite, nor body pains, no diarrhea, no shortness of breath, nothing. In fact, I'm very active.
Right. I understand your point. Your point is, in spite of fever for 1 day or 2 days or 1.5 days, your RT-PCR is negative, whether you are worried or not. You should be worried about, because the thing is, RT-PCR is negative does not rule out you are a COVID. RT-PCR is negative does not rule out you are not having any COVID. What is RT-PCR? RT-PCR is a test depending upon the lab to lab, that depend upon the 350 viral marker and 500 viral marker. If your viral load is not there, RT-PCR will give you false negative. That then the question of blood levels and the CT scan it comes. So most of the time we have seen patients are coming with some symptoms of this RT-PCR negative. They have gone and they are coming with the serious this. So in your point, your RT-PCR is negative, and you have told some April 30th, and today is May 23rd. So 23 days you are asymptomatic means nothing to worry. As I have told you, 10 days you are asymptomatic without anything, just forget it. So my second point is added to that. Somebody is found to be RT-PCR 1 day fever, and then he has done the RT-PCR. Maybe too early to do the RT-PCR because the viral incubation period is 2 to 14 days. If the RT-PCR is negative, still he or she is having fever or loose motion or body pain continuing, repeat the RT-PCR. Or they can be simply isolated, because if they are mild symptoms or just mild symptom, home isolation for 14 days, and after that they are free to move around whenever necessary, or emergency service. So isolation is not required. In your case, you have done isolation for more, I think for 14 days. I think you are free, you are nothing to concern about your health. I hope, Kashyap, you got me. Nothing,
Thank you,
nothing to
sir.
worry. Nothing to worry.
Doctor, why there are many cardiac arrests happening after the COVID negative and during the post-COVID? What is the reason behind?
There are post-COVID complication is one of the important topic actually. And what are the post-COVID complication if the patient recovered? Can you hear me?
Yes, doctor, we can.
Yeah.
Can you all, sorry, can you all others who is not talking, please mute yourselves again? Thank you.
Post-COVID complication are very, very common nowadays. The first and foremost complication is the lung fibrosis. Patient will have weakness because the lungs are fibrous, so oxygen level to the body is down. It will take some time. Most of the COVID ICU patients, those are recovered from the ICU ventilator. It will take so long time because the lung fibrosis, it is sometimes it's a permanent damage, even though they have recovered. Second part is the most important is the cardiac, heart related. COVID causes thrombus. Thrombus means blood clots. So routinely we are giving to high risk patient. Most important complication in COVID is a heart. What it does, COVID causes thrombus, and by that patient will have a heart attack. The clot will is stuck up in the heart. You will get a heart attack. If it is stuck up in the brain, you will get a stroke. Most of the even post-COVID patients are having stroke also. And now pulmonary embolism. This is the if the thrombus is stuck up in the lungs artery, then pulmonary embolism. Third important complication is the secondary infection. Secondary infection, like for this thromboembolism, we are giving anticoagulation, like rivaroxaban, nicosprin, ticagrelol we are giving. So third, which I have told, secondary infection. So secondary, this is a virus. Secondary infection can be a fungus, can be a bacteria, for which we are giving this azithromycin. So directly azithromycin has got no role for the virus infection because it's antibacterial. It's not an antiviral. Doxy also a not antiviral. It is only prevent a secondary infection for which you are taking, almost all the patients are taking azithromycin or doxycycline. So bacterial part we have taken care of that. Thrombus part we have taken care of that. Now the third one which I have told is a fungus part. Any patient either recovered from the COVID or infected with the COVID, having a immune suppressed, like antibody level are low, immune suppressed patient like kidney failure, heart failure, or any heart disease, or even a diabetes. If you are giving a steroid is a very important treatment in COVID. As of now, all the even international agency in India and abroad also, steroid is one of the important. But when to give, how dose, how much you have to give is a very important criteria. And randomly they are starting so much of steroid in even at district level, that should not be encouraged. If you are having a immune compromised diabetes and some of the comorbidity like heart failure, lungs, then the fungus will grow. So that's what the going on is a black fungus. Most of the time, if you are taking a oxygen in the hospital also, the dryness, humidifier, this bottle, we have to change it with the distilled water. Most of the nursing home, they don't do because they are overloaded with the patient. But so many corporates now, they have implemented every day, once or twice, they have to change the distilled water. That is the most important thing. Second important thing is what you are wearing, the mask. If the same mask you are wearing for 2-3 days, the humidifier that is having some fungus growth will, because of humidifier, fungus growth, and it will go through the inhalation. By inhalation, it will go and spread into the first the sinusitis, then it will grow to the brain, and rapidly it spreads. So change the mask every day. At least wash the mask if you want. Change the mask or wash the mask. If you are in the hospital, a corporate, anybody, we have a very strictly stipulated guidelines. These are the doses. Don't take unnecessary steroid in your house that if you have. Third important thing is diabetes. Control your diabetes strictly in the sense that fasting sugar should be 116 less than 110, and postprandial RPS should be less than 180. So these are the free, if you do the precaution. So you are taking care of bacterial infection and fungus infection and post-COVID infection like thrombus embolism or heart attack. So these are the complications you have to take. As of now, we have seen fungal infection. Either you call it a black fungus or a white fungus. It's some type of one type of fungus. It's a mucormycosis. So it will grow only by this. There are few things, even though they are patients without diabetes and they are spreading, because it's again the same mask if you are wearing or you are in proximity with a fungal infected person and it is coming to your inhale. Just like SARS, it is growing and day by day it is increasing. And I think we have to check to we have to take care of all the precautionary measures to even to prevent the fungus infection also for a symptomatic or mildly symptomatic patients.
Thank you, doctor. You actually helped me to next question as well, which is I was talking about the black and white fungus. But now you told me that what we need to take care of, like humidity is the major important aspect here.
Right. If you are in the hospital, if you are having a diabetes, 100% you have to control your diabetes. If you are having any in the immunocompromised status, you have to control your you have to check and you have to be very careful. Fungus is a normal growth. If you are a little bit immune compromised, it will grow just like any surface. It will grow in your body. That will definitely affect all the organ like sinusitis, then eyes, and then brain, and it's devastating. So the treatment option is very less. We have antifungal, very limited option. Then we have to treat that. Again, that is a complication for that. What the public has to do, better not to go any of the public place, as even I can see in the future also, fungus also spread through the air only. It's a very small micron. It's not a big one to spread. So humidified oxygen, if you are taking, you have to be very careful. If somebody is infected with fungus, he can be infected to other person also. So in the news, we are seeing that patient without even COVID also they are having in Rajasthan. One patient just now today morning also I saw, maybe true, but this news channel they are exaggerating all these things. But 99%, which we have seen, our hospital also a mucormycosis black fungus center. So we have seen so many, but all the cases is a post-COVID, maybe because of steroid and diabetes and all the factors, they are coming to us.
So the
change the mask every day, or wash your mask every day.
Okay. Thank you, doctor. Thank you. Any other questions from the
attendees? Yeah. Doctor, if you don't mind, this is two last questions. This is not again. Now now that my whole family is infected, doctor, is it okay for us to move along, my mom, dad, and I, or should we still be in isolation?
I didn't got it. So you want to move around inside your house?
Yeah, inside the house, doctor. So can we all?
Yeah, of course. You are not supposed to go outside your house up to 14 days. Yeah. 10 days of the asymptomatic. After 10 days, you can go. 14 days is from the date of symptoms to 14 days, you should not step outside. So inside also, if all three are infected,
Right.
you can move around.
Okay.
But I request 100%, all three of you has to wear the mask inside your house. Why? You may be a middle-aged or young patient, your immunity status is good, and your viral infection is viral load is something around 500 mch, and your whoever your parents, they are elderly, maybe some complication like diabetes and hypertension, I don't know, but age is a factor. Their immunity level is there, so it may transmit from you to them. Already they are infected. I don't
Right.
want that your viral load will increase your father, your parents. If
Right.
the viral load has increased, then the complication will come. You can move around, but better to be in with the mask. Double mask is better, or N95 mask is a better option.
Okay, doctor, noted. And one last question, doctor. So, as I was saying, my father uh, has had this fever since last Sunday. So the very
This
next day,
Sunday,
last
last
Sunday,
Sunday means 7 days.
7 days, doctor.
Hmm.
So, on Monday, we got him tested, but the result showed negative. And again, we got him tested yesterday. It showed positive. But
Correct.
he's now normal. There is no temperature, doctor. So he also feels energetic. He just finished azithromycin 500 course and cifran 500 course, but he has not taken ivermectin, doctor. Does he have to take ivermectin now, or is it okay?
No need to take even azithral and cifran. Even only one drug is enough. Azithral and cifran both are antibacterial. Anyway,
Okay.
he has taken. I don't. Only one antibacterial is enough. That is.
Okay.
And second is, if at all any fever, only Dolo 650 or any paracetamol. If at all any fever. Third, he has to take some of the immune booster like vitamin C, vitamin D, and zinc. This
Right.
has been seen that these will increase some immunity. He can
Okay.
take some vitamins and zinc and vitamin D weekly once. That is enough for him. As I have told you, RT-PCR can be negative first attempt, and second attempt you can get positive. Better that you have done that, and now he is asymptomatic, nothing to worry. Give some vitamin tablets and zinc tablets, that will take care of your father.
Okay, doctor. Thank you very much, doctor.
Right. Thank you.
Doctor, this is Ranga here.
Yeah.
My mother is 67 and she was positive, and it's been 3 weeks now. She has recovered 3 weeks, and the doctor has prescribed her an anticoagulant for 2 weeks. My question is, do we have to, her D-dimer was 893 and CRP was 0.81 when she was admitted at those back in April. So doctor has prescribed the anticoagulant. So it's been 2 weeks, 3 weeks now. Should we have to repeat the D-dimer, CRP, and ferritin tests again, maybe in a couple of weeks, to check if they have
No,
come down?
no need, sir. No need. If a patient is having asymptomatic without any symptoms, no need to do any blood test also. If you are having any breathlessness and fever or body pain or something like any post complication like, then you can better to do some test. So this anticoagulant for 15 days you have taken, that is enough. Asymptomatic patient 15 days is more than enough. So I don't even recommend more than 2 weeks or 15 days. And the D-dimer and ferritin level also not required if your mother is asymptomatic.
Okay, thank you, doctor. That helps.
Yeah. So
Doctor,
Gokul,
can
we
you
can wind up.
sir, one last question?
Yeah, sure. Last question, please.
Sir, can you please explain about this blood test and why? Because my son is a medico, he was negative in the COVID, but then he was tested something in the blood and he had to repeat the test 2-3 times. So I just wanted to understand what is this, why we have to get a blood test, or what is it?
Second.
One second. Yeah. Can you hear me?
Yes, doctor.
Yeah. Okay. So, okay. So you are asking why this blood tests are required. Am I clear? I think right.
So I wanted to understand what is there in that blood test, or what is that he is suffering from.
Exactly. So we are dealing with a virus. So this virus, it has been seen that the viral load will be, how much is the viral load? That depend upon the sum of the blood test. As of now, we have seen that the viral load is more than the D dimer, ferritin level, LDH level, and interleukin 6 level will be increased. If your viral load is low, then it will be normal. So the D dimer and ferritin level and the CRP level gives us 2-3 things. One is a diagnostic. Yes, you are having a borderline, we have a 3 category: mild, moderate, and severe. It will give us the diagnostic one. Number 2 is for the treatment part, it will help. Depending upon that, we have given some of the antiviral, some steroids, and to treatment part, because the CRP level are high, then we are supposed to start the steroid level. So diagnostic part, treatment part, then the recovery part. Most of the time we have seen that the D dimer or CRP level or IL-6, interleukin 6, and LDH, ferritin, these are consistently raised post-COVID, means after 10 days. These persons are most vulnerable for the COVID complications. So we have to see the during treatment, we have to see, and after treatment, if the patient is symptomatic, we have to see these level. By indirectly, we will come to know that viral load are high or low.
Got it, doctor. Thank you.
I hope I am clear to you.
Yes, I got it, sir.
Thank you.
Doctor,
Okay.
my name is Sudhakar. I am 68 years old. I am on Azilsartan for the past 4 years. I am confused which vaccine I should take.
Any vaccine available as of now, you can take, sir.
And
now the vaccine crisis is there. If you are getting Covishield, immediately you take. If you are getting a Covaxin, immediately. Now, if you are getting a Sputnik, you can take, sir.
Yeah, one more question. I am allergic to even Dolo if I take it second time. And I am getting irritation in the eyes even if I take C vitamin, Selin.
So those allergic, if you are having all the allergic, so I request you, if you are taking the vaccine, there are few precautionary measures.
Yeah.
Tell to the doctor who or nurse you are whoever is inoculating you. So they should be very clear for up to 1 hour or 2 hours. They will keep you in observation. Don't take any vaccine in your house or in RWA, Residential Welfare Association. Better go to a nearest medical center or a hospital. Then you can inoculate your vaccine. If at all any mild symptoms will be there, they will take care. So don't do vaccination at your complex or any nearest inside your complex. That is very dangerous for you because you are already allergic. Go to any of the nearest hospital where they are inoculating. Stay there for 1 hour, after 1.5 hours, 2 hours. And if you are having any symptoms, nothing to worry.
I am also on treatment for BPH. I am taking Flodot every day.
You can take, sir.
Yeah.
Azilsartan and Flodec, all these things, prostate problem, all these things you can take.
Yeah, my wife is 58 and I am 68. I am retired. I am confined to home. We are getting home deliveries regularly. Is there any chance of us contracting corona?
Anything can be, sir. The chances are equally, but if you are not going, maybe chances 50% less, still 50% are there. Home delivery, we have seen so many patients not going outside. still they contracted because of drivers, because of maids, and because of home delivery.
And my wife is a diabetic patient. Any chance of getting black fungus staying at home also?
She's not a, I don't want to scare you, but chances are very, very less.
Yeah.
But the food delivery and all these things, I don't think, but chances are very less.
Yeah. Is it restricted to only COVID patients, post-COVID patients?
No. It is very premature to tell. As of now, we have seen it's a very early. The black fungus came to the picture hardly 2 weeks before. Yep. I cannot comment in this juncture but we have seen most of the, except 99.9%, we have seen post-COVID.
Okay. Thank you.
99.9% it is post-COVID. I don't want to tell exceptions. 99% is more than enough.
Thank you, Doctor.
Hi, Doctor.
Yeah.
This is Praveen.
I think this is the last Gokul. I have one more session at 12:30.
Yes, sir. Yes, doctor.
Right, Praveen,
This is the
please
last
go ahead.
question.
Thank you.
Yeah.
Thank you for the chance to talk.
Sure,
Okay.
please.
Myself, I've got vaccinated on 10th of April, but I got tested on 2nd May as a positive. Now we recovered yesterday. We got our RT-PCR also negative for me and my wife. So when should I take my second dose of vaccine?
Instead of RT-PCR, you should have done some antibody test level assay. So anyway, you have done it. So at least wait for 30 days, sir.
30 days. Okay. Yeah.
Yes.
So,
Don't
my wife,
go because already you are having antibodies level more than 20. So no need to take immediately vaccination second dose. 30 to 45 days after you can take second dose of vaccination.
Okay, for my wife, she was not having first dose, and
she can take. She can take. She is not a positive, and you have isolated yourself.
Positive.
Pardon?
Positive. She was
tested positive. Then she has to wait for 30 to 45 days.
Okay.
For the second dose, she can wait up to 30 to 45 days.
No, she was not having the first dose also. I only had the first dose.
No problem, sir. Even if first dose or second dose hardly matter. Once the patient is positive, please wait for 30 to 45 days.
Okay.
If you are so much of concern about this, then after 15 days, please get it done the antibody test. If your antibody test is more than 20, please wait up to 30 to 45 days.
All right, sir. Thank you.
IgG antibody, if your antibodies are high, don't take any vaccine as of now.
Right, sir. Thank you so much, sir. Thank you.
Yeah, thank you. Yeah.
Right. Thank you, doctor. Thank you actually giving us a lot of your time and answering all the queries from the attendees and providing us a detailed description of COVID and post-COVID aspects. And thank you all the attendees and our chapter board for joining on Sunday and making this a success. Thank you very much. And doctor, as a part of our thank you, we have a tradition of honoring the panelists with two bountiful trees that we will plant in Sundarban National Park.
Oh, so nice of you.
And we will send you the certificate, and there will be a QR code in that. You can actually check those trees, how they are developing and all that. I will provide that certificate in a week time also. And thank you again for joining, and thank you very much for giving us your valuable time. Thank you all. And this will actually end the session. And I hope all of you got some valuable suggestions and information regarding the COVID.
Absolutely. Thank you so much, Doctor. It was very informative. Talking to you also gave me a lot of strength. And Gokul, thank you so much for arranging this session. It was much needed. Thank you so much.
Thank you.
Thank you.